CEN Test Prep Exam Audiobook. Question 1. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Beck's triad consists of hypotension, from decreased cardiac output, muffled heart sounds, from fluid in the pericardial sac, and jugular venous distension, from impaired venous return. Question 2. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ichthyomosis. Option B, rhinorrhea with glucose-negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Classic signs of basilar skull fracture include Battle's sign, postauricular ichthyomosis, raccoon eyes, periorbital ichthyomosis, hemotympanum, blood behind the tympanic membrane, and CSF leak, rhinorrhea or otorrhea, which tests positive for glucose. Question 3. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects: Option A, open-angle glaucoma. Option B, acute angle closure glaucoma. Option C, conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 4. The best method to remove a prosthetic eye in an emergency is: Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue. Question 5. A patient presents with sudden onset worst headache of my life. The nurse's first priority is: Option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. The sudden thunderclap headache suggests a subarachnoid hemorrhage. A non-contrast head CT is the first diagnostic test to rule out hemorrhage. Lumbar puncture follows if CT is negative and suspicion remains high. Question 6. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 7. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 8. A patient with a spinal cord injury at T1 is bradycardic and hypertensive. This is characteristic of: Option A, hemorrhagic shock. Option B, cardiogenic shock. Option C, neurogenic shock. Option D, septic shock. The correct answer is option C, neurogenic shock. The loss of sympathetic innervation in neurogenic shock results in unopposed parasympathetic activity, causing vasodilation, hypotension, and bradycardia. Warm, dry skin below the level of injury is also characteristic. Question 9. A patient leaving against medical advice, AMA, must be informed of. Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 10. Which finding on end-tidal CO2, ECO2, monitoring indicates successful endotracheal intubation? Option A. ECO2 of 0 mm Hg. Option B. Persistent ECO2 waveform with each ventilation. Option C. ECO2 of 50 mm Hg. Option D. A flat line waveform. The correct answer is option B. Persistent ECO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 11. Ovarian torsion presents with. Option A. Bilateral lower quadrant pain. Option B. Sudden, severe unilateral lower abdominal pain with nausea. Option C. Painless vaginal bleeding. Option D. Fever and purulent discharge. The correct answer is option B. Sudden, severe unilateral lower abdominal pain with nausea. Ovarian torsion typically presents with acute onset, severe, unilateral lower abdominal or pelvic pain, often accompanied by nausea and vomiting. Question 12. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because. Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 13. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates. Option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is option B. Hypoperfusion and anaerobic metabolism. An elevated serum lactate, 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism, which is a key indicator of severe sepsis and septic shock. Question 14. Murphy's sign is used to assess for. Option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Murphy's sign is elicited by palpating the right upper quadrant during inspiration. If the patient experiences sharp pain and abruptly stops inhaling, it suggests acute cholecystitis. Question 15. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A. Confront the colleague directly. Option B. Report the observation to the charge nurse or manager immediately. Option C. Document the observation in the patient's chart. Option D. Call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Confrontation can escalate the situation and compromise the investigation. Question 16. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B, to apply traction. Option C, cover the wound with a sterile saline moistened dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline moistened dressing and immobilize. In the emergency department, the initial management of an open fracture includes covering the wound with sterile, moist dressings to prevent further contamination and desiccation, and immobilization of the limb. Question 17. Priapism is a urological emergency characterized by Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option A, painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 18. The most effective method to control severe bleeding from an extremity wound is Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Direct, firm pressure applied to the wound is the most effective initial method for controlling severe external hemorrhage. Tourniquets may be used if direct pressure fails. Question 19. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 20. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is Option A, obtain a stat chest X-ray. Option B, needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 21. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mm Hg and in the left arm is 130/80 mm Hg. The chest X-ray shows a widened mediastinum. The nurse suspects Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, blood pressure differential between arms, and widened mediastinum on chest X-ray is the classic presentation of a thoracic aortic dissection. Question 22. The most common cause of airway obstruction in an unconscious patient is Option A, laryngospasm. Option B, foreign body aspiration. Option C, the tongue. Option D, mucosal edema. The correct answer is option C, the tongue. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly and obstruct the airway. The jaw thrust or head tilt forward/chin lift maneuver is the initial intervention. Question 23. The most common cause of lower gastrointestinal bleeding in adults is Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Malloy-Weiss tear. The correct answer is option B, diverticulosis. Diverticulosis is the most common cause of lower GI bleeding in adults. Upper GI bleeding is most commonly caused by peptic ulcer disease. Question 24. Meningitis is an inflammation of the Option A, brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Meningitis is inflammation of the pia mater, arachnoid mater, and the cerebrospinal fluid within the subarachnoid space. Encephalitis involves the brain parenchyma. Question 25. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: option A, heart rate and blood pressure; option B, mean arterial pressure, MAP, and intracranial pressure, ICP; option C, respiratory rate and oxygen saturation; option D, central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP, ICP. A normal CPP is 60 to 80 mmHg. Maintaining adequate CPP is critical to ensure cerebral blood flow in patients with elevated ICP.